What's happening, guys? Coming to you from the Underground Strength Gym. Zach Evanesh. Pow. No easy day, and it's freaking freezing. I know you people out in like Minnesota and Wisconsin laugh at this weather, but man, my gym stays cold. Anyway, we had some great questions coming in on Twitter. Told everybody if you ask me a Twitter question, it goes to the YouTubes. PJ Newton, Underground Strength Coach. He's got some good questions here. What are my 3 favorite exercises for lower body rehab? So 3 knee surgeries on the right knee. Training a lot of athletes through the years. We see a lot of meniscus tears, ACL. We also see things like PCL, MCL, but not the ACL torn, and they don't have surgery. So favorites are the sleds. Forwards, backwards, lateral. They're excellent. Those are the first things I usually do when an athlete could start moving again after a little meniscus or when they're cleared from physical therapy. And of course, I'm not a physical therapist, so don't get all worked up. But as a strength coach, especially now, compared to 10 to 15 years ago, man, the injury rates of athletes have skyrocketed, several 100% probably. The amount of injuries I used to see was like nothing. You know, now we have kids that have common injuries and it's really an overuse issue. They just don't get the rest and recovery that they used to. Emotionally, they don't get the rest and recovery they used to. I know I'm getting on my soapbox here with that, but I always tell people I'm 41, so I tell the parents when I'm talking to them with their kids, I go, parents, you know, when you were an athlete in school, do you remember like Johnny saying, oh shit, I need Tommy John surgery? How many kids in your school had to get a simple scope of the knee from a meniscus tear? I only remember one person having it, one. Otherwise, I don't recall anybody having surgeries or all these injuries. And then around about 2005, started seeing those injuries creeping up a little bit. And then more and more every year. And what's not ironic is the athletes I tend to see in that middle school time, high school as well, they're weaker, slower, they're carrying a lot of excess body fat. So physical education needs to step up, and the sport coaches who claim to be strength coaches and threaten their kids to not come to the gym to a strength coach, you need to do a better job if you're gonna threaten the kids. Back to today's show after that interruption. So number 1, sleds, no doubt about it. Number 2, now we've got some variables going on, but I found that even light deadlifting with all these kind of knee injuries, they tend to bring back integrity of the joint, strengthening the hamstrings. We'll do partial squats onto a bench, right? Just squat down to a bench. It'll be a box squat. And then I'm taking it from there. It really depends on the injury. But for me, it was always like, boom, you're gonna do sleds, and then you're gonna start doing maybe a trap bar deadlift from a high handle or a conventional deadlift with very light weight, kettlebell goblet squats, and then eventually moving into bodyweight stuff of like walking lunges. The unilateral leg strength takes a little bit longer, but you could always do kind of minimal range of motion. So I'm not sure if I have a top 3, but number 1 is sleds. I love them. Working with a couple guys now at Rutgers who have some knee injuries that really could be considered candidates for getting surgery, but we're keeping them strong. We do our Zercher squats, we do our deadlifting variations, we're doing a lot of hamstring and posterior work, and we do sleds every workout, and that's in season. I see these guys twice, sometimes 3 days a week, sled drags on every single workout. So there are definitely the top 1, possibly top 3. That's gonna really depend on each individual, but it's usually gonna be very lightweight, limited range of motion, intensity very low, and essentially I always say this. I go, as soon as you feel kind of discomfort in that area that you had surgery or injury, we call it a day right there. We don't try to push through it. And then the next time we try to maybe increase the volume a little bit. Volume could be maybe we work a little harder, maybe we get 1 more set, maybe the range of motion opens up another inch or 2. So there's many ways to manage and control volume and intensity. And what I'm always doing is I know this is going a little bit overboard, but this is probably the most important part. When I was 19, I had my first knee surgery, tore my meniscus, and I felt how before surgery, how my knee interfered with everything. It would swell up. There was always this kind of like stinging, stabbing pain in the knee. I couldn't, do any running, jumping. It just didn't feel good. When I got surgery, I remember after surgery, my doctor said, now guys, this is like 1996, I think. My doctor said for 2 weeks, just don't do anything and then go back to normal work. I remember I go to the gym and I'm gonna do legs that day. And I was bodybuilding then, 1996. Some of you watching weren't born then. So I was like, all right, I'm gonna do my leg extensions and leg curls. So I lay on the bench, I go to do my leg curls, and my left leg comes up all the way and my right leg's like stuck halfway, the range of motion limited. I'm like, shit, mother effer, I don't know what to do. Then I tried doing this, that, the other thing. I remember going to like specialists of the knee. We were going to like Temple or UPenn, I can't even remember. Traveled to like 2 or 3 specialists, each one giving me silly stuff. Get this trampoline and jog on the trampoline. I used to like put the trampoline in my room, watch bodybuilding VHS tapes, and I would just be jogging for 30 minutes on there. If all I did was start sled dragging, start doing bodyweight squats to a bench, eventually remove the bench, increase my strength, maybe start doing some bodyweight walking lunges, some very easy back extensions on the 45 degree, maybe even light RDLs. Then what happened is, I remember saying, I must have gone for over a year with the knee bothering me. And I said, you know what? I'm done listening to the doctors. I'm gonna do whatever feels good for me. And when it hurts, I'm gonna stop. So my plan was, and I was bodybuilding, right? This strength conditioning information wasn't really out on the internet that I knew about. So I said, every leg workout will have some sort of a pressing motion, a squat or a leg press. Then I'm going to do some sort of hamstring exercise, a leg curl, and every workout's gonna get RDLs to work on stabilizing and doing a little bit of stretching in the hamstring. So I picked 3 exercises. And I remember squatting, and let's say I got up to like 165. I was like, all right, that hurts, done on squats. Move on to the leg curl, hamstring exercise, and then RDLs. Next time, 185 on the squat. Then it was 225. And I remember every workout just climbing and climbing. Then before I knew it, boom, I was back to my 365, 405 squats. It was because I did this. I listened to my body. If it hurts, I didn't try to push through. I didn't get emotionally distraught over the situation, and I just kept my head in the game. But every workout, I got better. And that's what a lot of people forget to do, is hey, if I could get 1% better today, then by the end of the month, I'm 30% better, 31% better. It's every day taking a step forward. So I think a lot of people, they kind of sulk, they sit on a couch. Move the body. Movement restores function. No, I'm not a physical therapist, but I've had enough injuries and worked with enough athletes with injuries where we help them come back. And that's it, guys. Obviously, nothing takes the place of a competent PT who also was an athlete and knows how to train, because then they understand how to move forward properly, how to not be too conservative and also not too pushy. Some athletes push too quick, too fast, and they re-injure the area that they injured. So if you listen to the podcast with Dr. Jewett, he said that even if a minor surgery, the full integrity of the joint or the injured area, it's really not back to normal for like at least 12 to 18 months. So that there's something to be said about that. And especially with coaches, and we're always trying to showcase what we do and Instagram this and that, sometimes you're pushing the envelope because you want more views on the Instagram and shit. I'm as guilty as anybody with that stuff. You try pushing too fast, I think it would be a lot safer if we weren't trying to impress other people. Slow and steady wins the race. Peace out, guys. Hit the links below. Talk to you guys soon. Here on YouTube, subscribe and share. I want to pump up the subscribers here. And make sure, if you have a question, use the search function here on my YouTube channel. Type in kettlebells, type in legs, type in back, type in deadlift, type in injury, mental toughness, wrestling, athlete, football, whatever it is, type it in, you'll find an answer. Peace, guys. Thank you.